Thank you very much, Mr. Chairman. Last week I was home in Washington State and I heard firsthand from families and communities who are facing this epidemic. I heard from a young man who ended up in foster care because his parents struggled with drug use and mental health issues. I heard from a mother who felt helpless as her son experienced addiction. He sought help, he struggled with relapse, and tragically died of an opioid overdose. I heard from another young parent whose children were taken away because she was unable to overcome her addiction. I heard from an elementary school principal whose students should be learning to read and write, should be running around full of energy and excitement, but are instead struggling to focus at school because of the trauma of their parents' addiction at home. On a previous trip to a hospital in Longview, Washington, I heard how half of the babies there were born to mothers addicted to opioids. And just as I've been listening to voices back in Washington State, this committee has been listening here in Washington, D.C., and learning more about what our communities need to fight this national epidemic. I am very grateful to all of our witnesses today for adding your voices to this discussion. Technology and data offer important opportunities to address the opioid crisis and prevent addiction and avoid the tragedies so many families are facing. While we can see the promise of this approach through efforts such as prescription drug monitoring programs, which almost every state has established, there is a lot more we can do. These electronic databases, which keep track of prescriptions for controlled substances, can be a great resource to fight the opioid misuse. However, big data by itself doesn't guarantee a big impact. We need to use that data creatively, protecting the privacy of patients while finding innovative ways to protect their safety and health. Some states are pioneering ways to make that happen. For example, some states require doctors to check the database so they are aware of a patient's existing prescriptions before they write new ones. States that require this saw a drop in opioid prescriptions, drug-related hospitalizations, and overdose deaths. Others have built-in systems that alert doctors of alarming patterns or signs that a patient may be at risk of drug misuse. Others have made PDMPs easier to access and use by integrating them with electronic health records. Still, while many states are looking at new ways to put their data to good use, there's also important data many still cannot use, the data collected by their neighboring states. Too many of the PDM systems are not sufficiently interoperable, and that means they aren't sharing data and working effectively with each other. As a result, the prescription a patient receives in one state may not show up in the system of another state. Two doctors in different states may not see they are writing prescriptions for the same patient. They may not have the data to see a pattern of substance misuse or to prevent one from developing. We need more states to move towards an interoperable PDMP system so that we can put the pieces together and give doctors a full picture of a patient's prescription history. And it isn't just states that have to understand the role that technology and data can play in addressing this epidemic. Pharmacies, prescribers, patients, all stakeholders have to take a look at how advances can help prevent and address opioid misuse, whether through more responsible prescribing based on risk factors, safe disposal of controlled substances, or safety checks by pharmacists when they dispense. And we must also be mindful of the importance of patient privacy. Data has to be easy to use, but hard to misuse. People dealing with addiction already face stigma and may fear speaking out or seeking help. We have to ensure that our data practices and protocols don't create new risks or fears that patients' most private battles might be made public against their wishes. Striking that balance is not an easy task, but it is an important one. We've made great progress so far in striking difficult balances and responding to this crisis with bipartisan solutions. I'm hopeful that through conversations like the one we're having today, we can continue that bipartisan progress as we look at how technology can empower partners fighting this crisis at every level, from federal, state, and local governments to healthcare providers, to educators, to public safety officials, and to families like the ones I meet in Washington State. I look forward to hearing from all of our witnesses today, learning more from your expertise and experience. And Mr. Chairman, I very much look forward to our continued work together and with many senators to find and move forward key legislative solutions to the challenges we face fighting this crisis.
Thank you.